Well, good afternoon, everyone on the East Coast. Welcome back to the National Minority Quality Forum's Friday webinar series. I'm Brandon Garrett, the CEO of the National Minority Quality Forum, and we're having a discussion that's really near and dear to me. That's why I have to put on my Saints jersey and my with Bobby Hebert from South Lafourche Parish on it. But we're talking about Hurricane Ida, disaster recovery and relief. As you all know, the area, not only the area of Southeast Louisiana, but from Philadelphia to New York, all the way from the Gulf Coast, we've sort of dealt with one of our larger, I think it may be one of the most, if not the most expensive natural disaster that hit the United States. And so it's good we know the numbers, but do we know the toll that it's taken on our healthcare system, our communities? So that's why I'm so excited to have two veterans and folks that we work with at NMQF on the regular basis, state representative and head of the Louisiana Legislative Black Caucus, Mr. Ted James, JD, double Southern University graduate, undergrad in law, and then Dr. Nicolette Louissaint, who has worked with us for years and through her work as executive director at Healthcare Ready. And we all know that we know and love future doctor, Dr. Candidate Mia Keys. Mia, as she came to us, starting off as the health policy director for Congresswoman Kelly, then at the American Medical Association, and now back with Congresswoman Kelly and National Minority Quality Forum as the Congresswoman's chief of staff. And I believe she's in the Chicago suburbs in the district office right now, helping out on local issues with the Congresswoman. So, but without further ado, I want to just turn it over to Mia, and I really look forward to today's conversation. So.
I feel the same way, Brandon. Really excited to be here with all of you. Thank you as always, NMQF, for hosting really very timely and necessary conversations, and also just being really very thoughtful about the people you invite to this platform. I'm really looking forward to talking with both Nicolette and Ted today. As you mentioned, Ted being, a Louisiana state representative and consistently being a leader on the issues across the state, and currently leading on local leading the charge in terms of local needs with respect to the impact of health and healthcare, or the impact of the storms on health and healthcare on locals in the area. And then of course with Dr. Nicolette Louissaint, who's, as you've mentioned, been working on community resilience for quite some time. And now we really want to focus your part of the conversation a bit on Hurricane Ida, and more generally on issues of disaster recovery, especially because we're also now about to really commemorate and celebrate the lives of those who lost their own lives during 20 years ago when the planes went down during 9/11. And so it's certainly on my heart and mind today. I imagine it's on others. And so I want to, as we're crafting this conversation, to really help people to understand that what happens across the nation, what happens across the world affects us all in a really very local, relevant way. So I want to open up the conversation to both Ted and to Nicolette. Just let us know, before we get into the questions themselves, how are you both feeling? And where's your heart, where's your head today? Nicolette, I'll start with you.
I was preparing to start with the person closest to the ground. Thank you so much for having me. First off, I think there's a lot to reflect on. Also today, FEMA actually released a definition that they are using in policy and practice for equity. It's the first time that's ever happened as well. So there's a lot happening. My heart, my mind is certainly with the people of Louisiana. But I think the other part of this is that none of this is happening in a vacuum. And so the sensitivities that we are seeing as it relates to understanding all of the things that are happening at the same time, what it looks like to begin to consider recovering from COVID and surviving a hurricane. the wildfires that are happening in California, the tropical storm. I mean, we're in an era where there is so much happening that there's a tropical storm moving through Florida. There was an earthquake in Haiti, and we are approaching the anniversary of 9/11 tomorrow. And all of those things are diminished in the wake of some of the more severe events. So, but that's really where my mind is. I think that, you know, in addition to the infrastructure and medical tolls, there's a psychological toll to the level of vulnerability that we are all navigating right now. And I am very mindful of what that means for how and where we engage strategically, not just in policy, but also in practice.
Really appreciate you using both of those words together, you know, vulnerabilities as well as the strategy and being strategic about answering needs. Thank you for that, Nicolette. Ted, how are you?
Yeah, I mean, I don't even know how I'm feeling. It has been a, you know, whirlwind here. I'm in Baton Rouge. We were, you know, inconvenienced with the loss of power for 4 or 5 days. Of course, everyone outside of the state of Louisiana is always focused on New Orleans. You know, it was not lost on any of us that Hurricane Ida struck almost to the same day as Hurricane Katrina. So you have folks that are mentally still dealing with the aftermath of Hurricane Katrina. And then in an area that's very familiar to Brandon, you know, St. John, the Baptist Parish in Laplace, that area was hit hard in Katrina. That area was hit hard with Isaac. And again, that area was almost, you know, devastated with Hurricane Ida. On top of that, we are still in a state with some of the highest COVID numbers, right? Some of the highest deaths, some of the highest rates of hospitalizations. And the ironic thing that happened in Houma, one of the first buildings to see damage was a hospital, right? You know, here in southern parts of Louisiana, there's a major issue brewing with a nursing home where they evacuated their residents and put them in warehouses with feces on the floor and no adequate, you know, housing or no adequate transition. And that transfer was approved by our State Department of Health. On top of that, there's a major election that has just been pushed back. So I worry about you know, what happens to voters who are already, there's a huge attempt to marginalize and, you know, push out voters of color, those same folks that have been impacted here, that have the road to recovery is a lot longer for folks that don't have resources, right? There are people already on the ground with their contractors doing work, right? They have generators, right? They have contacted their insurance agents, and their insurance agents are already on the ground. And there are some folks that were in line yesterday just for 2 hours to get 6 chicken wings and to get cleaning supplies. So folks that have basic needs that have not been met. And then on top of that, we are walking into a redistricting session where we need these folks engaged so that their representation is increased, because we've seen the African-American population increase in the state. So that means that our voices should be elevated in elected bodies. And now we are all focused, as we should be, on the recovery of, you know, our communities after this hurricane, when we are still in the middle of, and I hate to say we're trying to recover from the COVID pandemic because we're still in it. So I don't know how I'm feeling. Right? It's too much work to be done to really stop and think about how, you know, myself as an elected official, I was just blessed that my daughter was with, you know, her mom in Houston, and I didn't have to worry about her while we didn't have power. And, you know, she's come back into her life is normal, and I have to act like life is normal for my little 4-year-old, so she won't, you know, be too impacted by all of this.
I want to merge something you both are giving voice to. So Ted, you were just talking about marginalization, you know, in the aftermath of the damage done to the infrastructure as a result of both these natural and unnatural, although we can likely make the argument about unnatural occurrences in our atmosphere. And then Nicolette, you were talking about the fact that FEMA just released, which by the way is in the chat, FEMA just released an operational definition of what equity has to look like within management. And I want to talk about what emergency management needs to look like, but the question I really want to drive home is marginalization inevitable in situations of catastrophic impact?
Marginalization is inevitable if we continue with the status quo. I think there are some decisions we have to make about what type of society we want to be. And as a reflection of that, what type of government and non-governmental structures we're going to put in place, what type of infrastructure we're going to invest in, and how we actually approach the work of emergency management from the perspective of understanding not just doing the most for the most, but actually doing the most for the least. And those are structural, fundamental shifts that we would need to make in how we approach many things, but at least emergency management. So it's definitely not inevitable. What I would say is inevitable is that disasters specifically will not impact everyone equally. I think that is what we know. And that is I think, an accepted fact in most cases. But how we provide stabilization and relief does not have to exacerbate that.
Yeah, I 100% agree. We, I have seen some of the best coordination post Ida, and unfortunately, I cannot equate that to preparation because we're in Louisiana and we know that a hurricane is coming. It has been COVID. Like, we have transitioned the mobile testing sites, the mobile vaccine sites to mobile hurricane recovery sites. And these are short term, right? The hot meals, the cleaning supplies, the ice and the water, those are very short term answers to what we know will be a very long term recovery. The FEMA change is huge. One of the issues that we have here that we continually have is after these disasters, we know FEMA will offer some type of assistance, right? So we push out this website and we tell folks, go save all your receipts, take pictures before and after, do all of these things, and then they apply for FEMA assistance, and then they get an email saying you were denied, but go to the SBA to apply for a loan. And I have been like really forceful in my conversation with FEMA because we had this in 2016 after the floods in Baton Rouge, and no one can tell me is there a metric, right? Is there a system? How do you determine who gets the grant versus who you push towards a loan? And when I look and what they tell me, always based on, we won't push folks to the SBA if we know that they don't have an ability to pay. I know that's bullshit because I know the families that come to my office that were denied the grant and are pushed to a loan. And that is a structural thing. That is something that can be fixed if someone is paying close attention to it. And I know that we're trying to elevate it as an issue, and I'm hoping that this administration will take heed to it because it will only further keep those that are impoverished in poverty if we are going to impede their recovery by not giving them that grant that their tax dollars paid for and force them to go the route for a loan, even though it's a low interest loan. On top of the mental toll, it's too much for folks, and it's a structural problem that we have to address.
And Mia, if I could just react to that very quickly, I think, that is such an important part of where we go first, not even where we go next. Just thinking about the burden that paperwork and the administrative processes provide, and the difference between understanding individual assistance dollars versus an SBA recovery loan, and who qualifies for what, and what paperwork do you need, and how do you present these things. There are some changes that have been made in the last few months on FEMA's side to inch towards that. But when you think about, the question that you initially asked, which is to me a broader, more systemic question, and you think about the fact that Some of this could actually simply be addressed by reducing paperwork burden, reducing administrative load. There are some immediate tactical shifts that can be made that do not require overhauling the system to just make a support and dollars more accessible during a disaster. So I think that, you know, there's a long game, but there's also this immediate, how do we make IA more approachable? How, you know, and I know there have been some steps that have happened just in the last 2 or 3 weeks. And the question is, does that go far enough? Does that reach enough? Does the formula still work, reflecting the fact that not everyone may be able to apply because they may not have identification, but not everyone may get all of the support that they actually need to recover based on those dollars. So there's a lot there to unpack. And I do, you know, appreciate Ted's point that we should start at the beginning, which is, how do we just make the forms and these processes and these routing procedures a little bit more transparent and clear?
And what I really appreciate about what you both are hitting on is, you know, to get back to this is something that really does irk me a bit as someone who's really invested in equity and equitable processes and equity as strategy. A lot of times when we think about equity, or we throw around words like equity and disparities and whatnot, people are thinking about diversity. People are thinking about inclusion, but we're not thinking about processes, and equity is a process. And what you're literally saying here is one equitable process that can save a lot of time and truly take burden off of those who are seeing the least of us, the you know, through in terms of burden, is just reduce paperwork. Yeah, I think, you know, especially when you're talking about companies that and organizations and federal agencies that are invested, so-called, in diversity, equity, and inclusion, and ridding the world of disparities, we don't have to harp so much on the idea of race and colorism, although we need to, and the impact of racism and structural racism. But really, the equity conversation is an administrative burden conversation. Yeah. So let's back up a little bit and tell us, give us a working definition of emergency management historically, and then what does the definition look like today? What audit look like?
I mean, I'll jump in. I think that in my perspective, I think that governmental agencies should be fully prepared with the staffing, the resources. You know that there are things very immediate, the need, sheltering, right? Transportation, generators, right? We should be fully stacked with those things, and it should be a full function of government, especially in coastal areas, right? We should not be in the process of trying to locate where a shelter is going to be, right? There should be immediate triggers that go off to local, state government to request this declaration at, you know, the moment we know, right, that something is coming. And the unfortunate thing about us here is, you know, things shift, right? We talked about earlier, we're starting to see these storms now that just come and they just hover, right? And we know that will be, you know, more catastrophic for us. So just as clear as you have a finance department, there should be an emergency management department that there's a checklist that goes off, right? You got to look at the senior population, right? Those that are in, and then the healthcare piece is so different now because of COVID, but those, how are we going to look at, you know, nursing homes, and what are we going to do there? You know, our young people, what's going to happen with our schools? So for me, I think that it's been too reaction oriented and not embedded into plans. And I'm seeing it as I've talked to different parish officials. Some folks, you would think that they are in Kansas and they have never heard of a hurricane because they have no systems in place. And I think it's just something that has to be totally embedded in, you know, local and state government to be able to, you know, flip a switch and start to respond to these things. Something very simple like AT&T, we couldn't even use our phones for about 12 hours, you know, and AT&T has just been, you know, I'm almost to the point where I want to leave AT&T because this has happened 3 times and Verizon, they dropped off 2,000, phones for folks to use and distribute in the community within a couple hours. Like those things should be, readily available. And I think that we are not fully focused on them until we are in the middle of the storm.
Brandon, I hope that our AT&T and our Verizon lobbyist friends are watching today's episode.
I'd also throw in there, emergency management by definition is the ability to stabilize a community after disasters. And it is the process by which we look at the entire life cycle that is required to ensure community stabilization after an event of any sort. So when I use the word event, I am talking about, there are many ways to think about it. Notice events, no notice events. Could it be a bombing attack? Could it be an anthrax attack? Could it be a cyber attack? Could it be a pandemic or a natural disaster? All of those things would be included in that very wide umbrella. But I'd also say one of the pieces that we really do have to be honest about is that emergency management functionally has been viewed as solely a government function. And while there is a federal component of that in the way of FEMA, there is also a state and a local component. And because we exist under a federal government structure, not a national one, the local government is always in control. So even when FEMA comes in, they are under the direction of that local government. So there's a huge structure that's been used, but one of the things that about maybe 3 or 4 years ago was shifted was thinking about how you look at community stabilization in the way of lifelines. And so the idea being that rather than saying we have ESF 6 that does mass care and ESF 2 and all of these things that don't mean anything, do we look at safety and security as a lifeline and say, in order for a community to be stabilized, there are these lifelines? Do we look at food, water, and shelter as a lifeline, all the way from agriculture to being able to shelter people, feed them, make sure they have the water that they need? Health and medical as a lifeline, energy and communications as lifelines. And so that framing, I think, is very helpful for this kind of a conversation, because if that is happening at the federal level and that's able to be carried down to the local as a measure of how we're looking at how the community is stabilized, we can say things like health and medical is fragile but stable, but communications is not stable. And we have to focus there because people cannot make calls out. 911 is not working. We know that is a problem. Same thing with energy. And right now, and I've said this often, I think I've even said this in this space, the way that our society works is going to be dependent on power. So as a person that believes that, we rise and fall by our health policies and practices, I still have to concede that all of that is centered around energy. And so if we do not have electricity, we do not have the ability to stabilize any community within the United States. So when we're thinking about those lifelines, we also have to be very honest about the fact that emergency management has to recognize that there is intermingling of those lifelines, and many of them are in service to one another. So how do we think about the ideas of stabilizing energy and food and water simultaneously as we are looking to stabilize health and medical? And how do we make it so that it's possible that our local jurisdictions are prepared to lead, which means they also have to know what to ask of the states, have to know what to ask of the federal government, and that the rest of the community ecosystem, which includes businesses, are very clear on how they can coordinate and what role they have to play in helping to stabilize the lifelines that they're a part of.
Nicolette, I must say, and I completely agree, and I must say that I don't think many organizations or really government entities are open to collaboration unless it's in the wake of an emergency.
So that's one of the hardest parts of my job. I've been very transparent about the fact that for an organization like ours, just the work of keeping the doors open. We've been in existence for 15 years. We started as an informal coalition after Katrina. Next year will be our 15-year anniversary of being a formal organization. And every single year it is a struggle. And it's a struggle because The dollars, the energy, the political will come in the wake of the disaster. But as soon as we get to some semblance of stabilization or the media coverage drops, there's no interest. And when there's no interest, there's no investment. And so trying to make the case that we actually have to do more in the way of investing around mitigation, more in the way of investing around preparedness programs, that we actually have to have dedicated recovery plans that will concede that recovery is not going to happen in a bubble. So that means that the communities that are still recovering from Katrina are now also going to be recovering from Ida. The communities that were hit in 2016 with the floods were recovering from Katrina, were hit with the floods, have been navigating the pandemic, and are also going to be navigating Ida. But we don't go into recovery with the same level of energy and investment that we do response. And so we find ourselves in this cycle of only really surging the discussions and the investments when the disaster happens, and then looking around wondering why we weren't more prepared when the next disaster comes. And I do think that there are many people like me that are kind of over it at this point and are looking at it and saying, we know why we weren't more prepared. We did not make the choice to protect these communities in the way of preparedness. We did not make the choice to invest in recovery in a way that would actually harden our infrastructure and strengthen our communities to be able to respond to these disasters. And these are known events. These are things that we know are going to happen. Louisiana getting hit with a hurricane is not a new phenomena. Why are we not more prepared for it? But that's because we're not investing.
That's because we're not investing. That right there is we could end the program right there, but I want to build on top of what you're saying and ask Ted to comment on, you laid out for us, Nicolette, a lot of the concerns that you have as a leader in this space. Ted, from your vantage point, what are additional concerns that emergency management leaders are facing?
I think that Nicolette laid out something that really popped up. And yesterday when I was with the parish president in St. John, she mentioned that they were still having issues with our State Department of Community Development from Hurricane Isaac, which was many, many years ago, right? I still get calls in my legislative office from families that are still having issues with Katrina. So that tells me that something is drastically wrong, right? And we have families that are recovering from multiple different events. I like that, Nicolette, multiple different events simultaneously, right? One of the other issues, I got an alert on my phone that FEMA is now setting up a site for those that need help and assistance to register, right? There's an assumption that people can get there, right? So, and those type issues with we have to meet people where they are. That's one of the things that I see. We put government way here, and then all of the people are here. I know one of the things that we benefit from with our folks now that are applying for disaster unemployment, there's a mobile van, right? And you can take that van and you prop that up in a neighborhood and people could come in and out and register, right? I know FEMA has the resources to do something like that, right? So a lot of times, one of the mistakes that I'm seeing is that government is expecting these people that are still hurting and trying to recover to also have to come to them, right? I think that, one of the things that I tell folks that we have to think about, governing like we think about campaigning. In a campaign, you're not going to set up something and say, hey, come vote for me, come meet me here and let me tell you about me. You're going to go to where they are. And a lot of times we don't employ the same practices when we're actually governing, because we know when it's time to go vote, we know that there are transportation issues. We know that there's information issues. That's why we spend so much money with GOTV. We're making sure that we're pushing folks, making sure that we have ballots and making sure that we're doing all those other things. And we don't see the same energy around the recovery piece. And I was thinking about, as Nicolette was talking, as I saw the hundreds of federal employees that have been here over the last 10 days or so. Yesterday, I got a call from a hotel. Hey, we got so many people from FEMA leaving. So if you know folks that need hotels, send them over. That tells me that, like Nicolette said, that the focus is more on the response and not the recovery, because this is the time when you need folks the most. It's almost like a funeral, right? My friend is that his mom just died, and I'm like, dude, like this week, I know it's rough. Everybody's here, but people always tell you the hard part comes when everybody leaves, and that's what Nicolette was talking about. You know, we have folks that need to be on the ground helping, but they're leaving, and I hated to see what was happening with Hurricane Ida in the northeast portion of our country. You know, one, because I just hate to see these things happening, but number two, because I knew that folks were going to stop talking about Louisiana, because it's, oh, they should be prepared already. It happens all the time. And once you're seeing this type of devastation, the subway systems, right? You know, flooding, that takes away from the homeowners here that are fighting to have their parishes included in the Blue Tarp program, right? Baton Rouge was just included yesterday, and that is problematic because we did have some folks that sustained the damage. It wasn't at the level, but I think that there's a little bit of fatigue around these issues because, you know, folks all across the country, you hear it all the time. Why didn't you just evacuate? And to folks here outside of Louisiana, that seems like an easy feat, right? Like I talked about my daughter, her mom, like, yeah, they had the resources, right? She has a vehicle, like her parents live in Houston. You know, not everybody can do that. Not everybody can go and say, I'm gonna go stay in a hotel for 10 days. I can, you know, gas up and not know how long I'm gonna be on the road with my infant child. So there's this assumption out there that it's just so easy to get out and just leave, and it's not. And that is something very basic.
Ted, I think we lost you a bit, but Nicolette, it looks like you want to pick up on some of the things you're saying.
Okay, Ted, I think you're back now in case you want to finish that thought. Okay. No, I think you make an incredible point. And I think sometimes we talk about, you know, why didn't people just evacuate? Maybe there's value in us actually putting some dollars to what evacuation actually looks like. I know that without some planning, while I could certainly evacuate, 20 days in a hotel is a lot of money to spend out of pocket for most of us, right? So I think this idea of, you know, why don't we just, I always like to remind people that if it was as simple as why didn't we just, whatever that is in the way of emergency management, it would have already been done, because there's so many hard things. We do the easy ones first, right? So if it was that easy to say, just evacuate, you know, really think about what 10 days in a hotel plus evacuation plus feeding, because now you're not at home, what that costs for you and a little one. How are you going to entertain your family? Now, let's say you're in a multi-generational family. Not everyone is able to sit in a car for 4 or 6 hours and safely get to another destination. So there are some real complexities that come up when you think about what an evacuation could look like, especially an evacuation like this, where you're thinking about protecting your home and keeping your family safe and the expenses required for both. It's complicated, and we don't talk about it enough in a way that really teases through the feasibility. But I certainly take your point, Ted. I think it's so easy for us to point a finger and say, you could have just gotten out. But it's not nearly as easy as most people make it seem.
You know, the point you're both talking about in terms of energy for response, and Ted, I think you used the word fatigue for recovery. Are we seeing the same thing? So, and we're talking specifically about the hurricanes and the floods, but what about, let's bring the COVID conversation into this. Are there lessons that we're gleaning effectively from the COVID pandemic in terms of sustaining recovery, or are we still responding with high energy initially and then pulling back? Where are the gaps, and also where are the opportunities to really potentially for emergency managers to learn from the ongoing pandemic?
You know, I see some things that make me hopeful, in that COVID kind of that meet folks where they are. we really had to do that with testing, vaccine. And I saw it in the immediate response. But I think that those things are more for the moment and not the real sustained movement that it takes to, number one, how we had to really band together to slow the spread, right? And how we're going to have to do the same over, the next several months to help our citizens recover. So I don't think that, and the other piece with COVID, and especially with the government response, we still have a lot of folks that I serve with that want to totally shut down a institution of higher learning because of the president decided that you can't go to their football game without getting a vaccine, right? And we politicized the COVID pandemic so much that it's almost, I told somebody, I think it was Monday, that I almost felt like I lived in a different state because hurricane comes and it's not about zip code, it's not about anything other than let's help folks recover. With the COVID pandemic, it was the exact opposite. And if white folks were dying to the level that Black folks have been dying with COVID, we wouldn't even be having this conversation, because we would have, in a state like Louisiana, it wouldn't even be a fight. Everyone would have everything that they need. And now I'm finally seeing that we really do have some type of compassion, because everyone's kind of banding together to help recover here. But with COVID, there's still this question of whether or not this thing is real. And folks are seeing that it's, once the word got out that it was only impacting us at higher rates, game was over, right? It didn't matter. Mask was not going to do anything. And certainly, this vaccine piece is not something that I'm seeing government really, or my colleagues here really, jump up and down about, until LSU said you can't come in our stadium unless you're vaccinated. That's when we saw the numbers spike. And that's, we have to start thinking about recovery and that same space and start investing in it, beforehand, knowing that it's coming.
I think one of the, there was an article that came out earlier this week that was making the argument that we keep talking about the health system as being on the verge of collapse. But if we're really looking at it, the health system has collapsed. It's just that we have not really painted a picture of what that means. So the fact that folks can still go to an emergency department, they're thinking, well, it's still working, but working for whom? At what extent is, the average medical professional surviving in subpar conditions, and the average system or clinic going above and beyond their real capacity to try to meet needs. And I say all that because I think that is a part of the question we should be asking ourselves as it relates to where we are in COVID. There have been many points in this pandemic where we saw ourselves in a very tenuous position, but beginning to stabilize the community, which also gave health systems the opportunity to recover. And at each of those turns, we consistently made the wrong decisions. And so as we made those decisions, not only did we take further toll in our communities, we also took a significant toll on the health system that's been asked to limp along and try to continue to support needs. But we're also at this point seeing a number of chronic conditions and very serious prognoses begin to emerge from delayed well visits. So in addition to the upcoming flu season, the acute needs that we're seeing from wildfires and hurricanes and other localized regional events, we're also beginning to see those individuals finally get back to their doctors. I saw Senator Klobuchar actually, announce that she, finally got a mammogram and was diagnosed with stage 1A breast cancer. But she had delayed that because of COVID. It's just those kinds of things that are taking a toll on the system overall. And so oftentimes we go straight to, what does this look like for the average patient or community member? But we don't stop to really think about the systems that have to actually be fully in place, functioning and intact for us to have that care. And I just don't think that our systems are, to no fault of their own at this point, if we're being very honest, are going to be able to withstand the continued burden that the COVID pandemic plus all of these other events are taking on it. And at this point, I think we do have to start asking ourselves the question of what happens if your loved one has a heart attack and they're not able to go to an emergency department. That's the seriousness of the strain that is on the average health system today. And we've not reckoned with that even as we approach 800,000 lives lost in this country due to COVID. We're still not reckoning with the seriousness of the toll that we are putting on systems that we need in order to collectively survive.
Is that fatigue? Is that compassion burnout? Is that political will? What is that, Nicolette?
I think it's all of those. I think fatigue, depending on your vantage points, looks different. I've been very transparent about my own fatigue, and we've been responding to this since really January 2020. So at some point there is no more bandwidth. At some point there isn't a reserve to pull from. You're hearing medical professionals say that as well, but also supply chains are fatigued and strained, and they've figured out a way to make it work. But at what extent? And we can start the policy discussion of supply chains are broken, but let's also have a realistic conversation about what type of demand and surge at what cost for what reasons have been put on these systems, right? So I think there's compassion burnout. I think there's fatigue. I also think that there is this reality of COVID not being real in the same way for everyone. There's an argument to be made about how we've communicated from a public health perspective and whether or not our public health messaging has helped or hurt us, how we've educated this country on science and how the lack of science education has hurt us. Because when we start talking about vaccines or mRNA, the average American has no idea what we are talking about or how these things work. So I think there's a lot that goes into how we got here. And so there isn't a single silver bullet, but I also think, to Ted's point, so much of this is local. And if you are a white person in a predominantly white county that has not been significantly impacted by COVID, how does that shift your thinking and your approach? If you are an individualist that believes that all of these are personal decisions and that your decisions are yours alone and do not affect anyone other than you, how does that affect your approach? If you don't believe in a vaccine because you don't believe that this was done in a sound way, how does that change whether or not you're willing to get vaccinated or get the people around you vaccinated? So I think there are all of these pieces in addition to a health system that is collectively strained and not just strained with COVID, but strained with all of the other chronic and acute needs that have to be met.
So let's bring up that local piece a bit. Let's talk about that. So Ted, in your current capacity, but then also in all the other realms where you're active, right? Both professionally and personally, what are you doing, or what are your colleagues doing to really ensure that the attention locally is driven by those who are on the ground, who are impacted, and who are moving through? And the same question for you, Nicolette, with respect to Healthcare Ready and the plans that you all are rolling out.
For me, it's kind of changed. Like, I have benefited from my own personal COVID experience, because I think that when I was hospitalized, people, especially our age, started to be like, oh, okay, this is, it was serious. But it goes back to something Nicolette talked about that I think feeds a lot of the mistrust, because when this thing first started, if you're young and you don't have these issues, you should be fine, right? So 39-year-old healthy Ted ended up hospitalized. Wear a mask inside, don't wear a mask inside, if you vaccinated, this, and that feeds what.
While we're waiting for Ted to unfreeze, just in case you all have not seen the episode where he's talking about
what?
Oh, there you go.
Okay, am I back?
You're back.
Yes, you're back.
Yeah, I'm sorry. And this is still, I actually saw one of the cops trucks outside, so we're still having issues here as things, and I hope I don't get one of these rolling blackouts. So a lot of things have been happening here, but I think that one of the things that we've done recently with Delta, when it started impacting kids, that's when I think folks that had not been serious like really got more focused, and we saw vaccination numbers rise when young people started to get sick, right? And we hate that that happened, but we started to really push out information other places because we traditionally think of the church, right? A lot of folks don't go to church on Sundays, right? And there were other avenues, but everybody was trying to get their kids back, and that was a huge discussion for us. Like, you know, we had, I usually don't punt my responsibility, but a lot of times, you know, there was a huge discussion. Some families didn't want to go back to school, right? Some folks like, y'all need to do something. I'm like, look, call your school board member. And usually I will jump into any type of discussion, but on that one, because for me, I made the decision to send my 4-year-old back to school. And I'm really concerned about just the knowledge gap that already existed and what is happening with virtual education, right? Especially with kids of color. And I hear from parents all the time, like, I am having a hard time when I'm an essential worker, dad is an essential worker, grandma, we don't want grandma around the kids because grandma has all these different issues. We need them to go to school, right? For the simple fact that we can't afford to have anyone else take care of them. And then the knowledge gap. So we were able to really elevate some stories of parents that were willing to tell about their young people, and we started to see the numbers rise. And then when we started this whole lottery system, when we started paying people, we, you know, put yourself up for a lottery for college kids. You could win a $10,000 scholarship. If you get vaccinated, you will be entered into this pool. And we started to really think about incentives, and that helped us. But there's a lot of fatigue around here, and the threat of no football, that in South Louisiana, Brandon could tell you that is huge. So you want to go 2 years without being able to go to Tiger Stadium, and people started to get vaccinated, right? The Saints said, if you want to come see us play football, you got to be vaccinated. You know, and I think that as folks take the steps, businesses, restaurants, you know, airlines, once they start to say, look, we are prioritizing the health of the people that work for us. But then there's also another piece, you know, people are starting to quit jobs when that, you know, vaccine mandate is out there. And then that already exacerbates an issue of, you know, folks that are already struggling to get people back to work, for, you know, be it folks that, you know, we're getting unemployment, and or folks that are just fearful. And we had that conversation in Louisiana. I think it's embarrassing that we would have folks that make more money on unemployment than the wages they receive in Louisiana. And I've told my colleagues, that's more of the indictment is on us, not them, right? If we live in a state and folks, and we have the lowest weekly wage in the country. So, well, third lowest, right? You know, and if we have folks that are making more on unemployment, that is our problem. That's not a problem of that family. I know I'm rambling at this point.
No, but you're getting at the earlier points of structural missteps, you know, and political will there.
Yeah, and it was, I told my colleagues, some of my white colleagues, when this, you know, COVID, when we first started to go back to session, and they were just extremely upset that the weekly benefit amount was $241. And I said, man, you know, you don't even understand how grateful you should be that you've been in office for 10 years and you never knew that, right? So that means that it has never been an issue for the people of your community because you didn't even know this until COVID happened. So, you know, and that is, you know, there were some folks that were shocked and wanted to do something about it. And there were some folks that were more concerned with the business owner and not, you know, the folks that are working and the essential worker helping to stand that business up. So, I mean, just a lot of structural issues that all go back to what I believe is, you know, the equity conversation, right? You know, and investing in these systems, like especially the conversations about, you know, in our community, how do we get, you know, focused on, you know, those yearly checkups should probably be 2 times a year for people, some folks in our community, and not relying on the emergency room for primary care. But you have to be able to, number one, put places in communities that, you know, are accessible. And then we have to do more, especially on the federal government, to make sure that these specialists you know, we increase that Medicaid reimbursement rate, because I hear from specialists all the time that tell me, Ted, I would love to go and work with Medicaid patients, but you know, I got to get paid, right? And the system is broken. It takes too long. And I much rather, you know, deal with these private citizens and do a couple you know, summits on the weekends at the church and give a few tests there, but not really, you know, make it a part of my practice. And that's a policy discussion.
It's a policy discussion, and I certainly do implore everyone to lean on your members of Congress, particularly those who sit within the committees of jurisdiction to make these decisions. And also make certain that you're making the connection to your local needs. Nicolette, same question. What's Healthcare Ready planning to do?
So a lot of what we're already doing is what we plan to do to remain doing. Part of this is, you know, how do you keep your foot on the gas? And so that's what we're trying to do. A lot of the challenge that we run into, and this is a nationwide phenomena. We see it more in the Southeast because more things happen in the Southeast on a cyclical nature because of hurricane season. But community organizations often on the ground have a role in community, have space in community, have relationships, want to do things, but aren't trained or resourced to do them. And that to me is something that we've continued to see as an opportunity gap. If we know that these community organizations are there, they will know in their neighborhoods who the medically fragile people are, who the electricity dependent people are. They have the ability to get to them. That is a tremendous asset, but that cannot go without resources in order for that asset to translate into an emergency management capability. And so what we try to do is make sure that we are providing the type of trainings, the type of support, and then helping them to identify resources that continually fund that capability. It's not enough to say, you're a great organization, you really care, so we're just going to plan on you being there. And, you know, if you don't need any money for it, fine. No. This requires time, this requires resources. So how do we do the training and then get the resources? Right now, a big part of what we're doing, especially around IDA, so one of our less popular, less known services is that we do maintain a hotline. And when we focus on disaster stabilization and response, we're focusing on first and foremost getting the systems stable. That's our first thing. How do we make sure that the health facilities that need to be upright, going, you know, able to dispense medicines, how do they get what they need? How do the people within those systems have what they need? And then if there's anything that comes from that falls through the cracks, frankly, from that's what we end up finding funneled through our hotline. And so in those instances, we will really be focused on making sure that we are doing the work of actually reaching out to those patients. They will reach out to us using the 211 system. And we're seeing things that, you know, every time kind of take our breath away. For example, we just received a call last night from a woman whose husband was murdered 5 days ago. And her biggest concern is, I actually need my chronic care meds, and I'm having vehicle issues, and I need to figure out how to get my meds because I know that I cannot deal with all of these other stressors and start the individual assistance grant process until I have my medicine. I can't even think about burying my husband. And so those are the kinds of things that I use that as an example, but it's not dissimilar from other calls that we've received and other types of requests for assistance where they're saying there are all of these pieces that I need, but the first piece is my medicine. I need to know that my health is stable so that I'm able to withstand this. And so that's a big part of what we're focused on, but also making sure that the community of organizations that have the ability to provide that assistance in the easiest way possible are mobilized to do so. And then we're starting to think about recovery, because again, we've not really talked about COVID recovery. And at some point, we've got to talk about what it looks like to recover from these things in a way that is thoughtful and intentional, and hopefully makes us more resilient for future events.
You know, before I forget to remind our audience, the both of you have been present on this platform before. And I want to make sure that to the extent that we can in the last 4 minutes, link to your previous episodes so that people can go back and ponder some of the things that you've mentioned in your previous episodes and think about what we're talking about today. They're not completely dissimilar. So we've got just a couple more minutes left, and I want to make sure that we elevate, your final concerns in terms of takeaways for this conversation. What does our audience need to, out of everything we've talked about, what does our audience need to take away?
I'll let Nicolette go first because I want to address one of the comments that I just saw pop up in the chat.
Sure.
Yeah.
There's a role for all of us in emergency management. I think, while I talk about how we need to keep our foot on the gas as an organization, I think we collectively need to keep our foot on the gas. What we are seeing right now is that the marginalization that is happening due to COVID, due to Ida, is really going to harm many of our communities, not just in the way of economic and physical well-being, but also mental. And so how we think about this as an integrated conversation into our infrastructure, into economic prosperity. This is too often an aside from the other conversations that we have about what communities of color need, what the Black community needs to advance, what some of the vulnerable communities, vulnerable to disaster communities need. And this actually needs to be front and center, and not just when there's a Category 4 hurricane making landfall, but as a recognition that if we do not make these investments, these are the single events that have the ability to upend all of the other investments that we make in these people and in these communities. Because if we are not prepared for these disasters, we will see that all of the other money that we spend on schools and jobs and housing and health can get upended with the single Cat 4 or Cat 5.
Thank you for that, Nicolette. Ted,
I agree. And I saw the chat and I had to respond to the quote unquote, the comment about the powerless Black caucus. So obviously, whoever that person is hadn't really been paying attention to the work that we've been doing here in Louisiana with a lot of the drastic changes that we've made legislatively, and even with funding. We talk about funding for COVID. We fought extremely hard to make sure churches and nonprofits were able to, benefit from some of the dollars, and we know that will directly impact the Black community. And in other southern states where voting rights have been taken away from Black people, young people, not here in Louisiana, because the Black Caucus made sure not only did we stop some of those bills, but we advanced bills that extends early voting days. We've increased precincts and other places. And not to defend my members, but for the comment about us being powerless, that's someone that's obviously not paying attention. As in return, in regards to redistricting, I do agree with the fact that historically we have allowed for ourselves to be bargained for a very low price in terms of redistricting, because we should have a lot more representation in the House and Senate. Under my leadership, we're not going to do that. We already have a demographer in place. We already know that the members' districts that have, 80 and 90% African-American voters, those members know that the map that we are going to advance this year will not look like they look today. So we will be fighting extremely hard. And I do invite whomever that person is to take advantage of one of the several meetings that we're going to have, the redistricting meetings across the state, the ones that are a part of the official process and the ones that the Black Caucus will be hosting. So follow us on lablackcaucus.com, LA Black Caucus, Instagram and Twitter to learn more about what, and I am biased as the chairman, but the very powerful Black Caucus is doing. So I would invite you to take a look at that.
Dr. Nicolette Louissaint, the Executive Director of Healthcare Ready, really appreciate you being here. State Representative Ted James, as usual, with the two of you have just brought really very powerful reflections for us today, and then also some marching orders. And there were just some, I was scribbling notes as you all were talking, and I just want to re-highlight some of the things that you've mentioned. So FEMA's now thinking about what equity in operation looks like with respect to emergency preparedness. And to Dr. Louissaint's comment about keeping your foot on the gas, we've got to make sure that FEMA and other organizations that operate in emergency management are maintaining their accountability, their energy, and that local organizations are also a part of the conversation continuously and collectively, so that we're not fatigued, that the energy is not lost just because we're focused so primarily on response and not the long-term recovery, which gets at the more structural upstream issues, which the both of you have brought up. And then finally, I will say that I really hope that your families remain well. And certainly keep you all in my hearts and in my prayers. And for those of you who are thinking about how this connects to everything that we're not seeing. So Nicolette, you mentioned the impact of the disasters in Haiti and everything happening, even abroad. And certainly as we come up on the 20th anniversary tomorrow of 9/11, let's keep all of this in mind. So thank you once again. I'm going to turn it over to Brandon Garrett to close us out from NMQF.
No, I just wanted to once again thank everyone for joining us as we restarted we took August recess and we came back and we came back strong. I really appreciated the information that both Representative James and Dr. Louissaint have shared with us and given us, like Mia said, our marching orders. We need to be doing how we can help and be impactful and just be sensitive to the needs of folks from across all sectors and backgrounds. And so I just wanted to say thank you, and I also want to thank Mia. Welcome back to the Hill Life. And as Chief of Staff for Congresswoman Kelly, I know that under your leadership, the staff and the Congresswoman will excel and continue to excel. Finally, I just look forward to seeing you all again next Friday. We have a panel where Mia will be discussing just healthcare issues in general with the White House's Dr. Cameron Webb. So everybody have a good Friday. Help someone if you can. And I look forward to seeing you next week.